Conway Medical Center and WPDE News Channel 15 present Your Health, Your Decision.
Spine surgery is a very complicated, very technologically advanced specialty, and every year there are new advancements, and what I've seen is the trend toward more minimally invasive procedures that are done through smaller incisions that are less disruptive to the surrounding soft tissues, and many procedures now are done as outpatient procedures, whereas 20 years ago we would have never thought of doing it that way. There is a move toward trying to do surgical procedures on the spine that are disruptive to the surrounding tissues, and more we're doing procedures where you go through the front of the spine as opposed to going through the back, where you have to make an incision and cut through the muscles on the back of the spine, which creates scar tissue and a certain amount of pain involved with disrupting the muscles. So more and more we're moving toward gaining access to the spine by either going through the front and even by going through the side of the spine. But the two procedures that are very common that I do is what's called an anterior cervical discectomy infusion and also an anterior lumbar interbody fusion. And what that means is that the disc is rebuilt and repaired by going through the front of the spine. And it's done basically by removing the disc and putting a bone graft material in there that results in a fusion. Some of the newer devices that are available involve a technology where a blade or a plate can be inserted through the spacer after I've taken the disc out, which is the disc is the spacer that separates the vertebra. After I've taken the disc out by going through the front of the spine, there's a spacer that has bone graft in it that I insert in that empty space to separate the vertebra. And then these blades or plates can be inserted through that cage to lock the cage in place and hold it in position. And they can be put in through a device that allows it to be done through a much smaller incision. There's less retraction on the tissues, particularly in the neck, the esophagus, and the trachea, so it results in less difficulty swallowing afterwards, which is one common thing that occurs with the procedure done in the neck. So with this new technology, there's minimal retraction on the soft tissues. It's done through a smaller incision, and in most cases it can be done as an outpatient procedure. I've had very good feedback so far. Most of the patients, when I do the cervical procedure, they go home the same day. I'm finding that there's much less difficulty with swallowing afterwards. The pain relief is very quick, many times within the first 4 to 6 weeks, which is typically the amount of time you need for a fusion to take place. And they're very happy with the minimal incision, the minimal scar. And I'm seeing an earlier return to function. Patients are telling me they're getting back to playing golf much quicker, back to working out, back to work.
For more information, visit us online at conwaymedicalcenter.com.